I'm Hartley Newell-Acero, the Outreach Coordinator for Sawtooth Mountain Clinic, and this is the topic of the month. September's topic is the flu and COVID-19. Every year, right about now, an unwanted visitor shows up on our doorstep, and its name is influenza. Now, the severity of the flu can vary from season to season, but the seriousness of the consequences never really changes. During the last flu season, from October of 2019 through April of 2020, the CDC estimated that in the US alone, there were up to 56 million flu illnesses, 740,000 flu hospitalizations, and up to 62,000 flu deaths. This year, there's an added complication. It's another unwelcome visitor, and you know its name, COVID-19. At times, COVID-19 is invisible, and it jumps quickly from host to host without leaving any evidence of its infectious passing. Sometimes it leaves behind small signs, such as a sniffle or a tickle in your throat. At other times, though, COVID signals its arrival by causing fever and chills and muscle aches and a sore throat, coughing and fatigue. Unfortunately, those are the same symptoms as the flu. So imagine that it's a couple of months in the future and flu season's hit here. One day you wake up and you're feeling achy and you're hot, but you're also chilly and it hurts to swallow and you're coughing. Which one of the viruses is infecting your body? Is it the flu or COVID-19? There's no way to know without a test. That seems easy enough, except that now you've got to get out of bed and drag yourself down to the clinic or the hospital where they'll collect your sample. And you'll go home and you'll quarantine until your test results come in. In the best case scenario, you'll be feeling better in a few days, and that's when your test results will arrive and they'll be negative, and you'll go on about your business. There's another possibility though, and that's the one where it takes a while to get your test results. Or you get them back and they're inconclusive, and so you have to test again, and wait again, and quarantine again. And it could be a while until you get back to business. The easiest way for you to avoid having this second scenario play out, and the easiest way for you to reduce your chances of catching the flu, are by getting the flu shot. Now, there are a couple of ways in which it's possible to get the shot and still get the flu. One, it takes a couple of weeks for the protection from the virus to kick in. So if you were exposed to the virus right before you got the shot, or just after you got the vaccination, then it's possible that it just didn't have time to work. To help avoid this, the doctors at Sawtooth Mountain Clinic are recommending getting your flu shots in September this year. We're also going to be hosting 3 days in which we have drive-up clinics. So check out our website. I'll put the link and the drive-up clinic information down below, and that'll be a really easy time and place for you to get your flu shots this month. The second reason that it's possible to get a shot and still get the flu is that the virus is always mutating. So in this country, we base our flu vaccines on the viruses that are circulating in Australia during their winter, during their flu season. So we look at what's happening down there, and then we make our vaccinations based upon that. But in the time that it takes that the flu virus to leap from person to person and make its way from the southern hemisphere to the northern hemisphere, it's had time to change, to mutate. Now, sometimes these changes are small, and we have a really good match between the circulating viruses and the vaccine itself. Other times, though, that the changes are much greater, and the vaccine and the virus don't fit as well. The good news, though, is that even an imperfect match protects you from the worst of the symptoms. Getting the flu shot increases the likelihood that you'll avoid getting the flu. When more people get their flu vaccinations, the fewer people end up with these symptoms that could be either flu or COVID. This means the fewer people that have those symptoms, then the fewer people will need COVID testing. And ultimately, fewer people will require medical care. This saves the medical resources for the people that really need them. And these are people that are at a higher risk for complications from the flu. This is children under the age of 2, people over the age of 65, people that are pregnant, or people that have a chronic health condition, such as asthma, diabetes, or cancer. Not everyone should get a flu vaccine. Babies under 6 months of age and people with severe allergies to any of the ingredients, for instance. Some people should check with their doctor before they get their flu shot. For instance, if you're not feeling well that day, or if you've ever had Guillain-Barré syndrome. Vaccines are a powerful way for us to protect ourselves from life-threatening illnesses. And by keeping ourselves well, we help protect other people that are more vulnerable. So, would you like some help in thinking about any symptoms you might be having? How will you know if it's allergies or a cold or the flu or COVID? If you're curious about this, then I really suggest that you check out our written version of the topic of the month, because on the back, I've included a very clear little graphic that'll help you think about those symptoms. But even more so, I encourage you to call us at Sawtooth Mountain Clinic if you're not feeling well. Whether it's a little off or whether it's pretty cruddy, give us a call and talk to one of our triage nurses. They can help you walk through these symptoms and think about them and help you decide on your next steps. We're here for you. We're together through life. Thanks for watching.